Today I'll be sharing with you on how to transform our thoughts, transform our negative thoughts, unhelpful thoughts, unwholesome thoughts, using Buddhism plus a modern psychotherapy method known as cognitive behavioral therapy, or in short is CBT. I'm a psychiatrist, I'm also a Buddhist, so I apply both set of principles, which are actually very similar, Buddhism and CBT, in helping myself, also helping my friends, families, my patients on how to transform negative and unwholesome thoughts. I'll start by sharing with you the Dhammapada verse 1 and 2. Dhammapada is the sayings of the Buddha. The first two verses are very relevant to what we'll be discussing today. So Dhammapada verse 1, basically the Buddha says that the mind is chief, the mind is master. If we speak or act with unwholesome mind or unwholesome thoughts, suffering will follow us, like the wagon wheel that follows the foot of the ox. And then in Dhammapada verse 2, something similar. The Buddha also said the mind is the chief, mind is the master. If we speak or act with a pure mind or wholesome thoughts, then happiness follow one like one's never departing shadow. So basically, the Buddha is trying to say that we need to be very mindful of our thoughts. When we speak, when we act, we get to be very mindful of our thoughts. So if we have wholesome thoughts, then happiness follows like our shadow. If we have unwholesome thoughts, suffering will follow us. I got to learn about this before I learned CBT. CBT, as I say, it stands for Cognitive Behavioral Therapy. It's one of the international standards of talking therapy for people with anxiety and depression. So I'm a psychiatrist, I'm a psychologist, and a psychiatrist and psychologist. Yeah. Did I learn CBT first, or do I learn CBT from the Buddha first? Now, as I track back my history, actually I learned CBT from Dhammapada verse 1 and 2 first. CBT, the name sounds very sophisticated, like cognitive behavioral therapy, but basically cognitive is a psychological jargon. Cognitive basically means thoughts. Cognition, it means thoughts, or it means our mind, the way we think. Okay, so as I say, historically I learned from the Buddha first, so these are the two verses. But how many of you are aware that for every Dhammapada verse, there's actually a story behind? So how many of you are aware of the story behind these two verses? Verse 1 and 2. Not familiar, but you heard of the verse. I think most of us have heard of the verse, the power of the mind. Since you have not heard of the story, I will tell you the story from the Dhammapada verse 1. 1, but they are related. Okay, in verse 1 is there's one during the Buddha's time. There was a monk who was doing walking meditation. Okay, and when he was doing meditation, this monk was actually a blind monk. So he was blind and he stepped on some ants, and the ants died. Okay, so if I were to ask you, is there any bad karma involved when you do walking meditation? A blind monk by stepping on ants. So if I were to ask you, is that considered bad karma? Is that considered breaking the precepts of killing? How many of you think it's breaking the precepts of killing? How many of you say, no, it's not breaking the precept? You're very good. Okay. So somebody actually, some monks actually brought the issue to the Buddha and asked the Buddha the same question. So is this killing? Is this breaking the precept? Is it bad karma? Of course, the Buddha said what you said just now. is not a bad karma. It's not breaking the precept because the intention is not there. The thought is not there. So it's related to what we are discussing today. There's no intention to kill. Of course, there was killing, but there was no intention to kill. Okay? The monk did not plan to kill. So from a karmic point of view, it is not considered a bad karma. However, in one of the monk's previous life, so the one I mentioned just now was during the Buddha's time. And the Buddha has the ability to read our past life. So in one of the previous life of this monk, he was a physician like me. So I have a special affinity with these two verses, This monk in one of the previous life, he was a physician. Initially, he was a good physician. Okay? And he had one patient with eye problem. So he tried to help this lady eye problem. And the lady was very poor. But the lady said, never mind, if you can cure my eyes, myself and my children will be your maid, will be your slave. So the physician, okay, I'll try my best. You cannot pay me, never mind, but you and your children, the whole family become a slave and serve you. So the physician tried his best to cure the lady. And the lady was cured from the eye condition. Okay? But when the lady was cured, the lady lied to the doctor. So actually recovered already, but told the doctor not recovered. Guess why? Because recover already, you have to be the maid, So this lady cheated, the patient cheated. Okay? But this doctor also had an unwholesome thought. He knew, when you're a doctor, you knew the patient cheat, you might know. So he had this doctor at that time, the previous time. So he gave a poison to make the lady blind again. Okay? Then if I were to ask you, so this time in this part of the story, is it bad karma or good karma? That is bad karma. It is harming and it's intentional. It was planned. The one doing walking meditation was planned. No, there's no thoughts, no intention. The intention was just doing mindful walking meditation. But in this one, actually deliberately planned. I give a medicine, which is actually a drug, something which is a toxic, a poison to make the lady blind. Because of the karmic effect, during the Buddha's time, he was born as the blind monk. So interesting, isn't it? Actually, every Dhammapada verse, there's a story behind it. So you might, when you go back today, you might go read about it. Every verse. So this is story behind the Dhammapada verse 1. It's a nice story to illustrate us the power of mind, power of intention, power of thoughts. Okay. If you are new to Buddhism, after you listen to this story, if you are new to Buddhism, you might have this impression that the power of thoughts, the effect of the thought, especially the karmic effect of the thought, is to wait until we die first. Then only you can see the effect. I said that if you based on this story, the doctor, because of the evil act during the Buddha's time, many lives, it's like many lives later, that only the thought or the intention got effect. So that might give us a wrong view that thought, yes, thought got effect, but you will wait until we die first, or wait until many lives later, they only get effect. Actually, it's not true. Okay, it's not true. Actually, our intention has immediate effect. Our thought, intention has immediate effect. Oh, the words are not coming up. Never mind, it's okay. Our thoughts our intentions have immediate effect here and now. And this is spotted by the modern cognitive behavioral therapy. The modern cognitive behavioral therapy, the principle is very simple. It is a therapy that I use to help people with depression, anxiety, insomnia, fear, worries. The principle is very similar to what the Buddha said in Dhammapada verse 1 and 2. The basic principle of CBT is how we think will influence how we feel. That's the essence of cognitive behavioral therapy. How we think will influence how we feel. The basic principle is same as what mentioned in Dhammapada verse 1 and 2, but of course the wording is a bit different. Of course the story is used a bit different. Because the person who came up with cognitive behavioral therapy is not the Buddhist. But the basic principle is the same. How we think will influence how we feel. And it can happen immediately, right here, right now. You don't have to wait until the next life. Just to give you an example. Now, if, let's say I ask if there's any questions. And let's say, suppose somebody asks a question. Suppose you ask the questions. Not inviting you to ask now, but suppose you ask a question now. And suppose I think, ayo, you ask a question. I don't know whether I can answer or not. Your question must be very tough one. Die lo, cham lo, si lo. Don't know how to answer. Don't answer lah. Suppose I think like that, what do you think will be my feeling? Uneasy? Anxious? Yes? Any more feeling? Worries along those lines lah. Unpleasant, anxious, worry. Suppose I think that way lah. Okay? But suppose I think, very good. Thank you for asking question. The fact that you're asking question, that means you are paying attention. Isn't it? Usually you ask question, that means you're paying attention. You are keen to learn. So suppose I think, this brother very good. Paying attention. Very keen to learn. Then how do you think I'll feel? I feel good. I feel peaceful. Then another scenario, same. You ask the same question, but suppose I think you want to challenge me, is it? You want to challenge me, challenge me, Then how do you think I will feel? A little bit anxious plus a little bit angry, depends on how much I can defend myself. If I cannot defend myself well, maybe I'll get a few angry, a bit upset, a bit frustrated. So can you see in this situation, the same situation of a person asking a question, if I had different sets of thoughts, my feelings will be different. Can see it? You don't have to wait until the next life to see the effect. Our thoughts have effect right here, right now. So far so good? And recently, I came across this phrase in Mandarin called 一念之差. By the way, I'm not Chinese educated, but I'm trying to pick up certain Chinese words and Chinese phrases, especially if it can help me to understand the Dhamma better. I like this phrase, 一念之差. How many of you are not Chinese educated? It's okay. How many of you not Chinese educated, but you somehow heard of this phrase, 一念之差? Okay. 一 means one. Nian is thoughts. 念头 is thoughts. And interestingly, in the Noble Eightfold Path, the Chinese word for mindfulness is 真念. 真念. Mindfulness in Chinese is called 真念. Same 念. Okay, so nian related to mindfulness. Nian also means thoughts. One thought, 自差 means different, 差别 means different. So you translate in English, that means one thought difference can have different effect. One thought difference can have different effect. 一念之差. Exactly what I shared just now, isn't it? You ask a question, one thought different only. One thought different. Are you going to challenge me, or are you interested? Are you keen to learn? It's just one thought difference only. It has difference in the effect. I like this phrase. 一念之差. Very powerful. Hey. So in the modern therapy called cognitive behavioral therapy, that is the acronym CBT, not the criminal breach of trust. No. CBT in psychology is called cognitive behavioral therapy. Therapy means treatment, so it's a form of medical treatment. More specifically, it's for treatment for mental health conditions. Like insomnia, anxiety, depression, panic disorder, my field. Okay? So that's why it's called therapy. C is cognition, but it basically means thoughts. In simple, it's thoughts. B is behavioral. So if you are anxious, according to CBT, that means if you're anxious, you don't want to be anxious, you want to be calm. You need to either change the thinking or change the behavior. So you either change the C or you change the B. Behavior can be action or speech, or you change the thinking. But since this talk is focusing on thinking, I'll focus on the C. So the earlier side I mentioned, one thought difference can have different effect on the feeling. Okay? It'll be interesting to know from a CBT perspective. Okay? The next 10 slides, they are from the CBT world, cognitive behavioral therapy world. So the cognitive psychologists, they have come out, they have sort of identified 10 thinking patterns. Or you can say 10 thought virus, like a virus, is a virus of the thoughts that tend to make us feel unpleasant, make us feel anxious, worried, upset, frustrated, etc. So the next 10 slides will be on this, we call it the thinking errors, or the cognitive errors, or the thinking errors. You can imagine like a mind virus like that. Because of this mind virus, because we think in this way, it causes unpleasant emotions, unpleasant feeling. So far so good? Very good. There are 10. I'm going to go through quite fast. This is just an introduction. Okay. So the first one is called catastrophic thinking. Catastrophic thinking. The description is assuming the worst possible outcome without evidence or automatically predicting negative outcomes. That is the CBT definition. But in simple language, in our language, this is the charm law, see law, say law kind of thinking. Or you speak Hokkien, it's a jala. See law, charm law, jala law. Oh my God, oh my Buddha. This kind of very kanjiang type of thinking, predicting the worst. Okay? Example will be if you're a student, you sit for the exam result haven't come out yet, you say, sure fail one. That is catastrophic thinking. Okay? Or if you are a meditator, no need to try meditate, won't one, I cannot meditate one, sure won't. That example of catastrophic thinking. If you go for a job interview, cannot get a job one. You no need to try, sure won't get one. This is an example of catastrophic thinking. Okay? And for every thinking error, I will give 1 or 2 suggestions on how to overcome. So for catastrophic thinking, one of the suggestions is we always focus on what we can do now. So instead of worry about the future and worry for the worst outcome, ask ourselves, what can we do now? Instead of worry about the exam outcome, focus on what we can do now. Okay? If you think you're not good in interview, or you lack certain skills, focus on what we can do now. That is one suggestion. So instead of die lo, cham lo, si lo, die lo, si lo, cham lo, the moment you notice that die lo, cham lo, si lo, ja lo, to lo, you change the thought to, what can I do now? What can I do now? Second one is called discounting positive. Okay? Discounting positive. I'll read to you the CBT definition first. Discounting the positive means downplaying or disregarding positive experience, accomplishment, or personal qualities. You look at this cartoon, it's very interesting. The black balloon represent all the no good things in life, ourselves in life. Whereas the color balloon about the good things. So discounting positive is like discount. You don't see the positive, you only see the negative. Don't see the negative. Again, if let's say in a parenting situation, okay, so you might have say, a mother will tell you, I am a bad mother. I'm not a good mother. I didn't do this, I didn't do that. I'm supposed to do this, I'm supposed to do that. I didn't do. Okay? But this mother who tells her the same thing actually could be a good mother in many other things, But the mother only pick on the negative one. So it's discount the positive, a lot of positive, but never think of the positive one, only think of negative one. Familiar? I see some of you nodding your head. Or even in, talk about parenting is one example, even our spiritual practice. Sometimes say, I'm not a good practitioner, I'm not a good Buddhist, I didn't observe my precept well. Actually, only occasionally we didn't practice well. After all, we are not the Buddha yet. So instead of picking on all the dark side, the negative side, the no good one, we learn to focus on the good ones. So the antidote is to focus on the good one. Sometimes it's very difficult for ourselves to focus on the good one. Sometimes by talking to another person. For example, just now you were MC, isn't it? Okay, I'm not sure whether you have these thoughts of, I didn't lead the puja well this one not good enough that one not good enough. I'm not sure whether you have those thoughts I'm not sure Well, if you have good thoughts, those thoughts, then if you follow these CBT principles, you try to reflect in which part of the puja that you did well. Okay? If you cannot find any, maybe you can talk to others, or the uncle, aunties, brothers, sisters, so you can get feedback on which part you have done well. Instead of cham lo, si lo, no good. No good. The puja from the beginning until the end, all horrible, terrible. Anyway, self-rule for leading the puja. Okay? Third one is unfair comparison. Unfair comparison. I just created this cartoon. My new hobby is drawing with ChatGPT. So I created this cartoon yesterday. Very interesting cartoon. Unfair comparison. It is comparing in an unfair way. Comparing in a way which undermines ourselves. It makes us feel no good, feel inadequate. Look at the cartoon. The fish is comparing with the giraffe. The fish want to be as tall as the giraffe. Cannot. First of all, it cannot compare. How can the fish be as tall as the giraffe? As long as the giraffe, maybe. It cannot be as tall as the giraffe. So the fish wish to be like a giraffe. On the other hand, you look at the giraffe. The giraffe wants to swim as well as the fish. Not possible. So what we mean by unfair comparison. A real case scenario in my setting, some of the place I practice in Sunway Medical Center. So around the Sunway Medical Center, there are a lot of colleges and universities. Sunway University, Monash University, Taylor University, Sagi, Inti, One Academy, a lot of colleges and universities. So I have a lot of students. Some of the students with a severe mental health condition, Okay? They may tell me, oh, my result no good. My friend's result very good. How come I like that? So to me, that is an example of unfair comparison. Your friend is not sick. You are sick. Imagine you have cancer and you're on treatment for chemo, radio, and you're still able to continue your study. If your result is not as good as your friend, isn't that understandable? It's not fair to compare, isn't it? But there's also another problem. Most people, they do not perceive mental health condition like physical condition. Most of the time, they say you got stroke or you got cancer. They say, yeah, understandable. But you have mental health conditions, people find it difficult to appreciate the concept of mental health condition. Example, unfair comparison. Okay? Or more typical example, comparing the children. Comparing the children. Wow, the neighbor's children can do better in maths. My children cannot do better in maths. Those are all unfair comparisons. Solution is no need to compare. No need to compare. Okay? We choose what we want to do in life. We choose what we want to learn. Okay? Give you another example. During the pandemic time, less activities. So one of the things that I challenge myself, I go and learn swimming. At this age, almost 50, I go and learn swimming, and I had childhood trauma. So I'm very proud. I conquered swimming. Basic one, not at the Olympic level. Basic, at least I can swim. Okay? So if I were to think, I swim so basic only, I cannot swim like those who are very good. They swim like the stroke. They are so relaxed. Like no need to waste energy. If I say, how come I cannot be like that? That's unfair comparison. I don't compare that way. To me, I choose my own syllabus. I choose to learn. I want to conquer my childhood fear. And then when I'm doing therapy, when I tell my patients that, hey, fear can conquer one, I did it. That is my whole purpose. That's all. I don't have to compete with how fast people can swim, how efficient people. No need to compare. Okay. Next one, telepathy. Telepathy. Okay. I think I will keep to the simple explanation. Easier in our own language. Telepathy is mind reading. It's like, oh, you think I'm fat, is it? Or you think I'm too short, is it? Or you think my talk is no good, is it? You think the words I use is too complicated, is it? It's all assuming and thinking what other people think. And without checking. And sometimes can be wrong, Can be wrong, So you can imagine this can lead to a lot of miscommunication and can lead to a lot of distress. Well, if you think people think highly of you, positive, then no problem. If you like me, no problem. The problem is if the telepathy, the mind reading is all negative one. You don't like me, you don't like the way I dress, you don't like the way I speak, you don't like the way I look. No response. You don't like me, is it? You're laughing, you're teasing me, is it? All these are mind reading. So you're very careful, Our thoughts are very elusive, very fast, So you need to catch it, 意念自差. One thought different, the effect will be different. So the solution is, don't simply assume. Don't simply assume. Okay? If you notice your wife today like not talking, cannot assume. Cannot assume you're angry, cannot assume a lot of things. Check. Today I notice you're a bit quiet. I wonder what is going on. Example, no need to answer me, I'm just giving you an example. Notice today you're a bit quiet, I wonder what is going on. Instead of assuming, oh, you're angry at me, is it? You're upset with me, is it? So don't assume, ask. I wonder what you're thinking. I wonder how you're feeling. So I wonder, how do you find the talk so far? Are you able to follow? Ask directly lah. Ask for feedback lah. Ask directly lah. Instead of assuming all sorts of things lah. Number 5 is this one quite easy to understand lah. This one no need to explain much lah. Too perfect. Everything want to be perfect. This one can cause a lot of stress lah. So the way I apply this in my clinic, I always remind myself, it is good enough if I can help some of my patients at some time for something. This is my mantra. My mantra derived from this. It is good enough if I can help some of my patients at some time for something. Good enough. But sometimes my mind cannot virus, or possess my Mara. Instead of that set of thoughts, you have the craving of, I want to help all patients at all time in everything. That one possess my Mara, cannot virus. Get a lot of stress, a lot of anxiety, a lot of worries. Lower down the standard. Or if you are a high standard person, sometimes it's important to have high standard in certain things. But what I learned is we cannot have a high standard in everything all the time. That is suicidal. Be selective. Be selective. Certain things we need to heighten our expectation and standard. Certain things is not necessary. So my mantra again is my mantra. I like that mantra. Of course, you have to come up with your own mantra. Mine is good enough if it can help some of my patients at some time for something. It's good enough. Overgeneralization. Overgeneralization is a thought that all women cannot drive well one. Yeah, you say yeah. All men talk like that one. All men always talk like that one. Women can never drive well. It's an overgeneralization. All mothers are like this one. All Chinese are like that one. All Malays are like this one. All Indians are like this, like that one. All people with mental health condition is like this one. All the lectures cannot teach one. Meditation is always boring one. Dharma talks are not practical one. Always not practical one. All these are generalization. So when we generalize, in a way we amplify the distress. First of all, it does not reflect reality. It does not reflect reality. And when we generalize, we also we have the tendency to generate the unpleasantness. We generate the distress. So the solution is be more specific. More specific. Example, one very specific example. Sometimes it's difficult. I would say sometimes, most of the time, it's difficult to get a good doctor in the hospital. Agree? Okay? It's difficult to find a doctor who is suitable, who is skillful, suitable. Okay? Well, that is reality. That is reality. It's not easy to find a doctor or any service provider. I don't talk about doctor. Right? It's difficult. But if we have the thoughts of all doctors just want money only, all doctors are non-ethical, that is overgeneralization. Then you have a difficulty. You have a family member who is sick, you want to find a good doctor, very difficult. If you have this thought, all doctors just want money, all doctors are unethical. Definitely difficult. How are you going to find a good doctor for yourself or a good family member? Reality is mixture one. Good. This one, black and white thinking. I just created this image yesterday. This one's supposed to represent Michael Jackson. But ChatGPT say it's a copyrighted. They cannot directly produce a Michael Jackson photo. They can produce something look like Michael Jackson. Why I put Michael Jackson? I think Michael Jackson got one song called The Black and White, is it? Black and white. So black and white thinking is also not helpful. Black and white thinking means if I'm not successful, I'm a failure. It's just between successful or failure. No in between. Okay? Is today's talk good or no good? If it's no good, it must be bad. Okay? Are you good in studies? If no good, that means it's bad. No so-so, you wanted to say so-so, isn't it? You want to say so-so, right? I want to say so-so. If you can think so-so, it's good. So life is not black and white. It's a gradient. It's a spectrum. So-so lah. So-so that means some okay, some not okay, some can be further improved. That will be a more healthy way of thinking. If you just good, bad, successful, failure, winner, loser, wow, life is very stressful, because if you don't win, you're a loser, No in between. Okay? The puja just now is either good or bad, If it's not, especially if you have very high expectation, if it's not good, it has to be bad. Those of you who are in IT and engineering field, got to be extra cautious with this thing. Because in my clinic, I notice people in the engineering field, IT field, tend to think in this way. Likely influenced by the binary system, 1001. Okay. This one is personalization of braining. Some people, the thinking process, they have the tendency to either blame themselves or blame other people. Let me check with you. When something horrible happens in your life, do you have a tendency to blame yourself more or to blame others more? Okay. How many of you have the tendency to blame yourself more? When something bad happens, there's a conflict, there's a quarrel, how many of you tend to blame yourself more? Okay. How many have a tendency to blame others more? The rest, not sure yet. The rest, the thought is very developed. Actually, no need to blame one. Got problem, just go and solve the problem. No need to blame one. But because sometimes we are brought up in a culture or brought up in a family of blaming. So we got carried away by this thought. It become habitual. Something goes wrong, somebody must be blamed. Today parking very difficult, somebody has to be blamed. COVID pandemic, somebody has to be blamed. Actually, that way of thinking often is not helpful. Blaming self also not helpful. Blaming others also not helpful. Just solve it, no need to blame. Solve the problem. Emotional reasoning is quite straightforward. Basically, very emo. So we are driven by the emotion. Driven by our emotions. For example, we are very anxious. When we are very anxious, the feeling will also influence our thought. Just like I mentioned, the thought influence our feeling. Feeling also influence our thought. So this one is the balik. Thought influence emotion, but our emotions also influence our thought. That's why it's highly recommended, if you are in distress, if you cannot solve the problem, learn to relax the body, calm the mind. Do puja, do chanting, do some walking meditation, relax the body, calm the mind first. When you're calmer, then the thoughts will be more wholesome, more positive, more helpful. Sometimes the problem is we are not aware that we are emo. If you're aware if you are emo, then okay, we can do some walking meditation. How to solve that? So my suggestion is whether you're emo or not emo, you still do puja. You make it a regular habit. The morning puja, chanting, walking, you make it a regular habit. Even you're emo, not emo, make it a habit. So that the body is relaxed, mind is calm. You can see things more clearly. Now thoughts can be more positive, healthy and wholesome. Okay, last one is mental filter. This one quite straightforward. This one is related to one of the earlier thinking errors known as discounting positive. Discounting positive is we don't see the positive. Mental filter is we see the negative. They are these two combinations. If you want to be depressed, follow these two combinations. Very easy to be depressed. Discounting positive is you don't see the positive. Mental filter is go and zoom into the negative. Using your puja example again. Sorry, use your right here example. Discounting positive will be when people give feedback to you, oh, the puja was very good, this part A, B, C was good. You don't see it. You discount, you don't see it. Mental filter is you find fault with yourself, you go and dig the fault. This puja, C not good, D not good, E no good, F no good, G no good, everything no good, no good, no good, no good. You zoom on the no good, no good, no good, no good, and you ignore what are the good one that people give feedback. Okay, so these are the 10 thinking errors or cognitive errors. They are mentioned in cognitive behavioral therapy. Okay, so the principle is the same. Principle is the same. Buddhism and CBT method. Principle is the same. The mind is chief. The mind is the master. How we think will influence how we feel. However, I have to acknowledge that the application will be slightly different. From Buddhism point of view, the application is usually from a spiritual point of view. Whereas the CBT, because it is not invented for spiritual purpose, the application is more for daily, more worldly challenges, like studies, like work, family, relationship, parenting, etc. Okay, good. Let's switch back to the Buddhist thoughts. In the Noble Eightfold Path, which is the Buddhist formula for happiness, so one of the recommendations is right thought. Four Noble Truths, the fourth one is the way to happiness, which is the Noble Eightfold Path. And one of the path is right thought. Sometimes translated as right intention. Right thought and right intention, which is related to what we are discussing now. In Dhammapada verse 1 and 2, the Buddha said that thought is very important. Thinking is very important. Intention is very important. But the Buddha didn't define what constitutes wholesome thoughts, what constitutes healthy thoughts. Isn't it? But in right thought, in the Noble Eightfold Path, is actually mentioned clearly. Right thoughts got 3 types, or 3 categories. Do you all know? Guess? Yes? Very good. Excellent. Very good. Okay, but I rephrase it just to make it easier. The first one is, of course, thoughts of harmlessness. Do no harm. Do no harm. Thought of harmlessness. The second one is thought related to loving kindness. Kindness, loving, compassion, generosity, helping others. One set. And the first set is harmless. Harmless. You can relate the precepts. The whole idea of a precept is to be harmless and be respectful. The first set, do no harm. And there's also in the doctor's Hippocratic oath, do no harm. You cannot help patient, never mind, right? At least do no harm first. Number one, do no harm. Second one is all related to loving kindness. Compassion, friendliness, kindness, respect. The third one is thought related to gratitude and contentment. Gratitude and contentment. So the way I summarize for my own practice is thoughts of harmlessness, thoughts of kindness, and thoughts of gratitude. I'm just rephrasing and summarize it. Thoughts of harmlessness, thoughts of kindness, and thoughts of gratitude. Okay, I'm going to zoom more into the thoughts of kindness and gratitude. I'll share with you how I practice. So the way I practice kindness I have sort of set my brain into a default mode. If I have nothing else to think, I will sing the Rasa Sayang song, the metta version, as a way to cultivate thoughts of kindness. That's how I sort of prompt my mind and condition my mind. Right? Rasa Sayang song, I'm sure you heard already, isn't it? But you might not have heard of the Rasa Sayang song, the Buddhist version, the metta version. I will sing to you. Right? Rasa sayang, hey, rasa sayang, sayang, hey. May you, may all be safe, healthy, and happy. May you, may all be safe, healthy, and happy. Rasa sayang, hey, rasa sayang, sayang, hey. May you, may all be safe, healthy, and happy. So you notice the lyrics, I modified the lyrics, so it's more consistent with the Buddha's teachings of right thoughts along the lines of loving kindness. Shall we sing together? Can I? 1, 2, 3. Rasa sayang, hey, rasa sayang, sayang, hey. May you, may all be safe, healthy, and happy. May you, may all be safe, healthy, and happy. Yay! Very good. So the way I practice is anytime, anyway, when I don't have anything to think, this will be my default. Even before sleep, I will sing this song. In my dream, I also sing this song. Before I see the next patient, the patient leave, I will sing this song. In the toilet, I also will sing this song. In the lift, sometimes in the lift, nothing to do, I also sing this song. So you set it as a default mode. So you ask, what are you thinking now? If you no need to use the brain, nothing to think, go into this. Rasa sayang, hey, rasa sayang, sayang, hey. May you, may all be safe, healthy, and happy. I also teach this to a lot of my patients. Sometimes you go to the hospital, it's a long queue, you have to wait for the doctors. You don't know what to do. If you don't know what to do, the mind will think of all sorts of negative things. So instead of being in the idle state, while you're waiting for the doctors for the appointment, you sing like Rasa sayang, hey, rasa sayang, sayang, hey. May you, may all be safe, healthy, and happy. So in the clinic, you wish everybody, you, other patients, the nurses, the doctors, wish everyone safe, healthy, and happy. Please include the doctors, they're also very stressed out. Sing in the mind, correct? No need. No need. Sing in the mind. You can hum. May you, may all be safe, healthy, and happy. In the mind. Then you generate a very positive energy, the loving kindness energy. So that is one way of practicing right thoughts of loving kindness. Another way will be thoughts of the gratitude. So I came up with this formula based on the teachings of gratitude, contentment, and okay. So I have this formula called Google What Went Well Yahoo. Google What Went Well Yahoo. www here, it stands for what went well. So one of my recommendations in my clinic, I make use of these beats. Okay, so I have this practice that I do for myself. I also teach it to my patients. Every night before you sleep, when you use the beats, you try to recall the blessings in life, the good things in life, the things we are grateful for. So one beat represents one thing we are grateful for. Okay, for instance, for today, before I sleep tonight, I say, this morning I make the right effort to come to Uttama Bodhi Vihara to do a Dhamma sharing. Okay, one beat. Okay, and then I remember your happy face, one more beat. And then I remember the MC for giving me the example to that, one more beat. So each beat represents one good thing. Things that we are grateful to, things we are contented with, or the good things. So we train the mind. Very simple. We use that as a tool. Of course, you can use that for chanting as well. Some people use it for chanting. Amitabha, 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 or Namo Tassa also can. But you can also use this to cultivate right thoughts along the lines of gratitude and contentment. Very simple ways. Singing is very easy. Rasa sayang, it's also very easy. But you have to make it a habit. Initially, when it's not habitual yet, you want to think, very difficult. I'll suggest you start with one good thoughts, one happy thoughts. After that, you upgrade 3 good thoughts. After that, you go the whole cycle. So very simple, practical way. And the right thoughts. Any questions so far before I move on? No question. I wonder what does that mean. I have to check my thoughts, No question means. My explanation is very good. I feel good. No question means. They're all confused. Okay. There's another sutta called the Vittaka Santana Sutta, found in Majjhima Nikaya number 20. If you are interested to read more, you can go to this sutta. The Buddha actually talks about 5 ways on how to relax our thoughts or how to stop negative, unhelpful thoughts. Okay, 5 ways. Also very relevant to what we are discussing today. Okay, the first method is to replace the negative thought with a positive thought. Example is, if you find yourself in a very discontented state, very dissatisfied, a lot of complaints, very, very frustrated, okay, then maybe you replace it with the thoughts of gratitude. So you focus on the things that went well in a day. Focus on the achievement, focus on things that are good enough. Right? Or you have angry thoughts, then you change it to kindness thoughts. Right? But I strongly suggest if your metta kung fu is not that high yet, if you're upset with the person, let's say I'm upset with you, you want to swap the thought to kindness thought directly to you, actually very difficult. Unless your kung fu is very, very powerful, very high. My suggestion, the easier one will be, let's say I'm angry at you. You switch to kindful thoughts, metta thoughts, not directly related to you. Maybe I like my dogs, I like my cats. Okay, so I got my dogs, my cat, or maybe my plants. So I switch my thoughts to my dogs, my cats, and my plants. Cultivate that kindness feeling, that loving feeling, to replace these thoughts instead of directly. Else it's not practical. Although in theory it's possible. I'm angry at you. I change to loving thought. May you be safe, healthy, and may rasa sayang, hey, rasa sayang, sayang, hey, hey, may you may all be safe, healthy, and happy. Yes, you can sing, but feeling is not there. Replace. Angry, replace with kindness. Greedy, discontented with grateful. If you're confused, then replace with the wise thoughts. How to replace with wise thoughts? I teach you one trick. How to replace with wise thoughts? You imagine what the Buddha will say. So this is a trick. Imagine what the Buddha will say. Of course, the Buddha is not right here. The Buddha is right here in front of us. We can ask. So imagine. Okay, I got these thoughts, angry thoughts, whatever thoughts, confused thoughts. Imagine what the Buddha will say. Sometimes we can get the answer. Of course, if you got spiritual friends, Kayana Mitra, of course I can talk to a friend. But sometimes we are alone, our friends are not around. We can ask, what will the Buddha say if you're in confused state? So that is to replace the confusion part. Second one is examine. Examine is you think of the negative consequences. Let's say you want to have the thoughts of smoking or all the unhealthy behavior, smoking. You think of the unwholesome effect, health. If you think I want to kill somebody, harm somebody, you think of the karmic consequences. So that one quite straightforward. You think of the negative effect. Hopefully that will stop us from doing that. You want to take drugs, you want to take alcohol, you want to abuse drugs, think of the consequences. Examine the consequences. 3 is ignore. Very practical, you know. Sometimes people say, oh, ignore is very simple. Actually, ignore is simple and practical. Ignore means don't think about it. But in ignoring, you don't think about it, we also keep ourselves busy. One of the very simple and effective methods to overcome negative, unhealthy thoughts is to keep ourselves busy with something meaningful. Sometimes no need to have lengthy Dhamma discussion and CBT. No need. No need. It can be very simple as you just going to do something meaningful, keep yourself busy, keep yourself occupied. In Chinese, in the clinic, I like to use this phrase, 有精神寄托. Keep yourself occupied. Keep yourself occupied, keep yourself busy, physically busy with something meaningful. It can be as simple as that. Sometimes you want to identify the thinking errors, you want to cultivate the right thought, wholesome thought. It can be very challenging, especially if you're not trained. The simplest way will be ignore the thought, ignore the person, keep yourself busy with something meaningful. That is under ignore. And I want to highlight, it has to ignore and keep yourself busy. If you just want to ignore, let's say I don't like you, let's say we have a quarrel, conflict, I don't like you, cannot, I just ignore. And do nothing, very difficult. Very difficult. Trust me, I'm sure you have enough experience. Very difficult to just ignore and don't do anything. So it will be easier, more skillful, ignore but distract ourselves with something meaningful. Either distract by doing something, or distract by saying something, or distract by thinking something which are useful or meaningful. Right? Next one is relax. Also very, very practical. Sometimes you want to identify the thinking errors, you want to change that, very difficult. All we need to do is just relax. Do whatever you can. Do whatever you can to relax the body and calm the mind. You want to do yoga also can. You want to do qigong also can. You want to do chanting also can. You want to do walking meditation also can. Whatever. Or sometimes it can be as simple as just have a good night's sleep. Relax. Okay? When the body is relaxed, the mind is relaxed, thoughts will naturally come down, usually. So number 3 and number 4 sound very simple. Actually, it's very, very useful, very practical. Don't you think so much? Keep yourself busy with something meaningful. Number 4, relax. Relax first. Do chanting first. No need to investigate the thought. Relax, calm down. Then only you re-examine. Then only you look at the thought later. Okay? So after you keep yourself busy, after you relax, if the thought is, the issue is still there, then maybe you can try number 1 and number 2. Number 4, suppress. Suppress, the Buddha in the Sutta said, suppress is last resort. So you try all the method already, you still cannot, you have to suppress. Suppress is like using willpower, using determination. Cannot! Must not like that! Should not like that! So you give yourself like a very stern, very, very firm warning like that. Must not, cannot. Okay? But it's not last resort. I actually understand why the Buddha highlight that it should be a last resort. Actually, in psychology, there's a research saying that trying to fight the thoughts directly using willpower, there's a thing called a paradoxical effect. It can bounce back one. So let's say you represent one thought. Okay, if I fight this thought very aggressively, it will bounce back. Then another thought, I fight with this thought, it can bounce back. It can bounce back. So in psychology, it's called paradoxical effect. It bounces back with greater frequency and intensity. So I really appreciate why the Buddha mentioned that in this sutta, that should be the last resort. It is still necessary, but it's the last resort. But we still need to be aware of it. Be aware of this one. I tried all methods already, cannot. Then you use this willpower. Okay? So this one comes from Vitakka Santana Sutta. Okay. A few more tips. So from now onwards, now we know the power of thoughts. 意念之差. One thought can have a difference. So as a suggestion for practice, on and off throughout the day. On and off throughout the day, take a pause and ask yourself, what am I thinking now? What is my intention? In fact, you can do it right here, right now. This moment. Ask yourself, what am I thinking now? What is my intention? So what are you thinking now? What is your intention? It's just for us to be aware. For us to be aware of what we are thinking, what is our intention. If nothing, go back to default mode. Either sing Rasa Sayang, may I, may you, may all be safe, healthy, happy, or you count your blessing. This is my suggestion, very practical practice. On and off, pause, what am I thinking now, where's my intention? Nothing very active, go back to default mode, loving kindness, Rasa Sayang, or count the blessings, be grateful. There's another set of practice under the mindfulness. Actually, that one is considered mindfulness. Right? You pause and be mindful. What are my thoughts? What are my intentions? There's one way of cultivating mindfulness. Mindfulness, pause and ask. Another way of cultivating mindfulness in the context of thoughts is learn to be detached from thoughts. Learn to be detached from thoughts. Let's say this represents our thoughts. We can cultivate the skill, the mindfulness skill, to able to watch the thoughts, to have a distance from the thoughts, so we are not sucked by the thoughts. So we have a choice. If it's a wholesome thought, no problem. If it's unwholesome thoughts, we need to be aware of it so they are not sucked into it. So there's a way to learn how to keep a distance. It's also part of mindfulness practice, and this is actually used in therapy. For your information, these days mindfulness is actually used in therapy. And there are many, many ways to learn that. One of the ways is by imagination. So you can imagine thoughts are like leaves on a stream. Thoughts are like leaves on a stream. So you watch, you're not in the stream. You watched. They stop. Is it part of the thinking errors, 10 thinking errors? Or is it the 3 right thoughts? So you watch. Or you can imagine the thoughts. You can imagine you are a bus driver and the passengers are your thoughts. It's an imagination exercise, but the imagination has a mindfulness component. It helps us to be detached, to be distant from our thoughts, to be aware of our thought, so we are not sucked into it. So we have a choice to respond to it. Imagine you're a driver and the thoughts are the passenger. Another one, you can imagine you are a chessboard. The chess pieces are your thoughts. You are not the chess pieces. We are not the chess pieces. We are the chess board. If you are a meditator, you probably notice that this is very mindfulness based. It's very meditation based. It's observing the thoughts, knowing the thoughts, observing the thoughts from a distance. But in CBT, they use this kind of methods to help to cultivate the mindful awareness. So we are the chessboard, we are not the chess pieces. The earlier simile is we are not the leaves, we are observing the leaf. Right? Okay. And last, this will be the last slide. Okay. The last few slides is all about mindfulness. The first one, how to be mindful of thought. The first recommendation is on and off, take a pause. Ask, what am I thinking? What is my intention? So second one is to develop the ability to keep a distance, to be detached from the thoughts. Okay, and this will be the last one, and this will also be my last slide. Okay, be mindful that thoughts can have different manifestations. Another way of saying it, there are many thought species. Thoughts can manifest in different forms. Thoughts can be in the form of belief, perception, interpretation, expectation, assumption, in front of image instead of words, meaning, or self-talk. This is extremely very important, because in my clinic, when I try to introduce CBT or try to introduce the concepts in Dhammapada verse 1 and 2, when I say thought is very important, when I say 意念之差, one thought different, they get it. But when they try to apply in their life, they cannot identify the thoughts. Then I start to reflect what's the problem. Then I realize that a lot of us, we don't realize that thoughts come in different forms. It's like, you see the picture here of different dogs. Okay, it's like I said, can you help me to find dogs? Can you help me to find dogs? Well, if you can recognize dogs actually have different forms, it'll be quite easy, isn't it? But if you are not aware that dogs come in different forms, it'll be a problem, isn't it? So similarly, thoughts comes in different forms, different manifestations, different species. And these are the various species of thoughts. So I'm going to just choose on one or two just to demonstrate. Okay. For example, thoughts can be in the form of interpretation. Thoughts can be in the form of interpretation. Okay. Example, scenario, I got a patient, show me the health screening result. Show me the health screening result. Okay. Then notice the cholesterol, LDL cholesterol. The bad cholesterol is 4.2. Okay. And then you notice 4.2, and you notice the face very stressed out. Okay. Then if I ask what are your thoughts, the patient may say, no, I don't have thoughts. But if I ask how do you interpret the result? The thought is there. So the person may have certain interpretation, 4.1 is high, or 2.6 is low, or 3.4. That's interpretation. So you get what I'm trying to say? If you ask directly, either you ask yourself or you ask another person, what are your thoughts? You may not get the answer. But what is the interpretation? Then you might get the answer. Right? Of course, you may not have the ability to interpret the result, but at least you're able to be aware of your thoughts. Got it? Another example will be expectation. Okay? So if I ask, what do you think of the talk today? Some of you might have certain thoughts, some of you might not. Okay? But I ask in different way, what do you expect from the talk today? It's slightly different. What do you expect from the talk today? There'll be difference in it. So what I'm trying to say, all these expectation, the need, the interpretation, they're all thoughts. They're all thoughts. Right? And different thoughts will have different effect. Mind is the master, mind is the chief. Different thinking pattern will have different effect. So whether you feel good about this thought or not, it's very dependent on your expectation. Okay? If you expect this thought to be a form of in-depth therapy, likely you're going to be disappointed, because this is not meant to be a therapy. It's meant to be a public talk. Okay? If you see this is just a public talk, it's good to have some awareness. Wow, I heard something that I never heard before. This is a good introduction. Likely you feel good.